Hi everyone, welcome to my channel. As we all know that this year 2020 has not been a very merciful year so far, and so many dreadful events have happened. The whole world has been locked up in their houses, which is leaving a very negative mark on people's minds, and people are getting mentally ill. In this video, I'm going to be talking about a very common mental disorder, the anxiety disorder. What is anxiety? Anxiety is frequently an anticipatory emotion, a sense of unease about a dreaded event or situation that has not yet occurred. Anxiety disorder. Unfounded fear or anxiety that interferes with day-to-day functioning and produces clinically significant distress or life impairment is a sign of an anxiety disorder. A number of factors play a role in the acquisition of disorders involving anxiety, including biological factors such as genetically based vulnerabilities and psychological factors such as personality variables, an individual's sense of mastery or control, attention to body sensations, and learning experiences. Social stressors and cultural rules or norms can influence the development and expression of anxiety. We begin our etiological discussion with a focus on the biological underpinnings of anxiety. Beyond the physiological causes of anxiety symptoms like hyperthyroidism, which means overactive thyroids, or cardiac arrhythmias, or asthma medications or stimulants, for example, excessive caffeine intake or withdrawal from alcohol, two main biological factors influence the development of anxiety disorders, which are fear circuitry in the brain and genetics. Fear circuitry in the brain. A variety of brain structures and processes are involved in fear and anxiety responses. The amygdala, a brain structure associated with the processing, expression, and memory of emotions, especially anger and fear, plays a central role in triggering a state of fear or anxiety. When we encounter a possible threat, the potentially dangerous stimulus rapidly activates the amygdala, triggering the hypothalamic pituitary adrenal HPA axis to prepare for immediate action, the fight or flight response. The ensuing chemical cascade prepares us to defend ourselves or to flee. Fortunately, the stimulus simultaneously activates the second and slower pathway in which sensory signals travel through the hippocampus and prefrontal cortex. Hippocampus, the part of the brain involved in forming, organizing, and storing memories, and the prefrontal cortex is the region of the cortex responsible for executive functioning, allows us to manage our attention, behavior, and emotions. These structures process the sensory input and evaluate any potential danger associated with the situation. Once the secondary fear circuit determines that no threat exists, signals are sent to the amygdala to curtail the HPA axis activity. The neural structures involved in the fear network are overactive in some individuals. This is partly due to insufficient availability of certain neurotransmitters that inhibit neural activity. For example, some studies have linked anxiety and fear with a reduction in GABA receptors in the hippocampus and amygdala. GABA is an inhibitory neurotransmitter that reduces the transmission of nerve impulses. Thus, with less GABA, there is potentially less inhibition of fear responses. Genetic influences. Genes modestly contribute to anxiety disorders, particularly when genetic factors interact with other important environmental influences. One specific neurotransmitter, serotonin, is implicated in both depressive and anxiety disorders. A polymorphic variation, it is a common DNA mutation, affects the length of one region of the associated alleles. Alleles is the gene pair responsible for each trait. It is possible to inherit two short alleles, two long alleles, or one short and one long allele. Carriers of the short allele are most likely to show reactivity of the amygdala when exposed to threatening stimuli. After discussing biological dimension, now we're going to talk about psychological dimension. An individual's psychological characteristics can also interact with his or her biological predispositions to produce anxiety symptoms. Those of us who engage in negative appraisal, which means interpreting events, even ambiguous ones, as threatening, have an increased likelihood of developing an anxiety disorder. Similarly, if you have anxiety sensitivity, which means a tendency to interpret physiological changes in your body as signs of danger, you might be particularly vulnerable to developing anxiety symptoms. Next, we're going to talk about social and socio-cultural dimensions together. Gender plays an important role in the development of anxiety disorders. Females are more likely to experience anxiety disorders than males. Women are more likely to be diagnosed with emotional disorders due to their lack of power, status, and stressors associated with poverty, lack of respect, and limited choices. These social factors produce stress hormones that may make women more vulnerable to both depression and anxiety. Cultural factors such as acculturation, conflicts also contribute to anxiety disorders among ethnic minorities. Exposure to discrimination and prejudice can increase the anxiety of people who are members of ethnic minorities or other marginalized groups, such as individuals with disabilities or sexual minorities. Culture can also influence how anxiety is expressed. Types of anxiety disorder. Anxiety disorder is an umbrella term that includes different conditions. First step is panic disorder. According to DSM-5, a diagnosis of panic disorder involves recurrent unexpected panic attacks in combination with a apprehension over having another attack or worry about the consequences of an attack, for example, feeling a loss of control or inability to breathe, and B, changes in behavior or activities designed to avoid another panic attack. These reactions must be present for a period of 1 month or more. Next, we have a social anxiety disorder. According to DSM-5, excessive fear of being watched or judged by others, extreme self-consciousness in social situations is known as social anxiety disorder. Next, we have specific phobias. Excessive fear of specific objects or situations, intense fear or panic attacks produced by exposure to those objects or situations are called phobias. There are some common phobias that people have, including the celebrities also. Acrophobia is phobia of heights, algophobia is phobia of pain, hematophobia is phobia of blood, nyctophobia is the phobia of dark, xenophobia is the phobia of being with strangers. Coulrophobia is the fear of clowns. Celebrities including Johnny Depp, Daniel Radcliffe, Billy Bob Thornton, and Sean P. Diddy Combs have this phobia. Claustrophobia is the fear of enclosed places. Treatment. There are two ways to treat anxiety disorders. One is medication, which can be prescribed by a good psychiatrist. And two is psychotherapy. It is a type of counseling that addresses the emotional response to mental illness. CBT is an effective treatment for anxiety disorders. The focus of this treatment is to teach the client to 1. Identify worrisome thoughts, 2. Discriminate between worries that are helpful to problem solving and those that are not, 3. Evaluate beliefs concerning worry, including evidence for and against any distorted beliefs, 4. Develop self-control skills to monitor and challenge irrational thoughts and substitute more positive, coping thoughts And 5. Use muscle relaxation to deal with somatic symptoms. How to manage the symptoms of anxiety. These tips may help you control or lessen your symptoms. 1. Cut down foods and drinks that have caffeine, such as coffee, tea, cola, energy drinks, and chocolate. Caffeine is a mood altering drug and it may make symptoms of anxiety worse. 2. Eat right, exercise, and get better sleep. Brisk aerobic exercises like jogging and biking help release brain chemicals that cut stress and improve your mood. Sleep problems and anxiety go hand in hand. Make getting good rest a priority. Follow a relaxing bedtime routine. And 4. Ask your doctor or pharmacist before taking any over-the-counter medicines or herbal remedies. Many of them contain chemicals that can make anxiety symptoms worse. Now let's take a look at the do's and don'ts for a person with anxiety. Number 1. Spend time with them talking about their experiences. 2. Indicate that you have noticed a change in their behavior or feelings. 3. Let them know that you are there to listen to them without being judgmental. 4. Highlight the option of seeing a doctor or a therapist. Don'ts. Do not pressure them to calm down or relax. 2. Do not avoid the person. 3. Do not pressure them to deal with their feelings with drugs or alcohol. 4. Do not help them avoid situations that makes them anxious. And 5. Do not assume that the problem will just go away by the time. We know that at times caring for a person with anxiety can be difficult, and it's not unusual for a carer to experience anger or guilt or fear. So firstly, learn about anxiety, then only you'll be able to understand why the person is acting that way. Secondly, it is important for the family members and friends to avoid burnout by looking after themselves and their loved ones. Make sure you spend time doing things you enjoy. This will help ease tension, limit stress of the situation, and ultimately make you a more balanced support for your loved one. So that's it for today's video. I hope you liked it. If you liked it, do hit the like button and subscribe to my channel. And I hope that I was able to give you enough or basic information about anxiety disorders. Do let me know what disorders or health conditions or disabilities or whatever you want me to discuss on my channel in the comments down below. Thank you so much for watching.